Hello everyone, welcome to this topic on asthma. Do you know that asthma is a common lung condition that affects 1 in 5 children as well as 1 in 20 adult Singaporeans? That's right, asthma is so common that the polyclinic sees several patients a day suffering from this ailment. Today we're going to share with you some common advice on asthma care as well as the symptoms of asthma, the triggers of asthma, the pathway for asthma medication, asthma medications as well as asthma devices. Asthma is a lung condition in which the airways are hypersensitive, reacting to stimuli that triggers the narrowing of air passageways as well as the excessive production of mucus. Asthma sufferers cough to clear the airways from phlegm developed by mucus secretion, and they may also develop shortness of breath and wheezing. So the loud hacking cough that you hear from asthma patients actually help them to clear away the phlegm from their air passageways. Asthma patients should also be aware that their lung condition can be caused by triggers in and outside of their homes. The common triggers are house dust mite, air pollutants, viral infection, change in ambience temperature, food, as well as drug allergies. So, what do you do when you or your loved one has asthma? One of the ways is to understand your personal triggers and avoid them as far as possible. If you find that your asthma condition is rapidly deteriorating, do consult your asthma doctor for the available treatment plans. Your asthma doctor should provide you with a personal written asthma action plan and adjust your metered inhaled dose accordingly to your level of control. Patients can also measure their asthma status using the Asthma Control Test Questionnaire and measure their airway status using the peak flow meter. Patients can also show their asthma control test results as well as their peak flow meter results to their doctors during their next asthma consultation. So, what are the types of asthma medicine available for asthma patients today? Let's take a look at the table. Reliever medication, controller medication, and the combination medicine. These are reliever medicine that opens up hypersensitive airways over a limited period of time. These are controller medicine to control the hypersensitive airways of patients with frequent asthma attack. This is combination medicine which combines the medicine of both the reliever medicine as well as the controller medications. Other asthma medication is also available, but it should be restricted to the more severe type of asthma. Patients should consult their doctor if they require such medications. If patient is provided with a written asthma action plan, they can adjust their dose and frequency of their medication according to their needs and asthma control status. Patients who had serious asthma attack before should be provided with a short standby course of oral steroid tablets for use during emergency. Inhalers in common usage are usually the metered dose inhalers, turbihalers, and accuhalers. Asthma sufferers should be familiar with the techniques used for the respective inhalers so that medicine can be delivered effectively to the airways. So if you are unsure of the techniques, be sure to check with your asthma doctors or nurses. And that's all we have today on this episode of Asthma Care. Do join us again for another episode of Asthma. See you!